This is Dr. Christy Webb, and I'm a psychologist in Chapel Hill, North Carolina. One of my areas of expertise is borderline personality disorder, or BPD, and I've made several videos on topics related to that. The reason it's called borderline personality disorder is that the term was supposed to describe people who are on the borderline between normal neurosis, which is what we all have, and psychosis, and who supposedly tip over into psychosis when they're under stress. Now, the topic of the name of the diagnosis, that's for a different video. In this one, I want to talk about what it means to say that someone with BPD becomes psychotic when they're stressed. What does psychosis mean? And what would that look like in someone with borderline personality disorder? Let's start with a definition of psychosis. We say that someone is having a psychotic episode when they're out of touch with reality. Okay, so what does that mean? Well, it might mean hallucinations, and hallucinations can affect any of our five senses. Auditory hallucinations are when you hear things that other people can't hear, like voices, and visual hallucinations are when you see things that other people can't see. Neither of those is all that uncommon in the world of psychosis. Less common are tactile hallucinations, so feeling bugs crawling on your skin, for example, or olfactory hallucinations, which is smelling things that other people can't smell. That one's a fairly alarming hallucination because it suggests that there's some neurological problem, such as a brain tumor. Another form of psychosis, in addition to hallucinations, is delusions. A delusion is when the person believes something that doesn't make sense in their culture. For example, the great composer Ludwig van Beethoven, dun 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 dun, right? He was absolutely convinced that he was born in 1772, which is great, except that that was 2 years later than he was actually baptized. He wouldn't believe any evidence to the contrary in the form of his birth certificate or the church baptismal records. He simply rejected the facts. He had a delusion that he was born in 1772 and that everyone was conspiring to lie to him. Now, that was a paranoid delusion, but there are other kinds of delusions, including delusions of grandeur. You might believe that you're the Messiah, for example. In order to qualify as a delusion, the belief must not make sense in your culture. Now, arguably, someone who believes that the Earth is flat or that the American moon landing was faked is delusional. But I once worked with a woman from a Central American country who believed that she saw her recently deceased brother. Now, this didn't scare her because in her culture, it's perfectly normal to see dead loved ones. She wasn't psychotic. She was grieving. Now, the DSM-5, but not the ICD-10, says that one symptom of BPD is, this is a quote, transient, stress-related, paranoid ideation or severe dissociative symptoms. This means that in the DSM description of symptoms, someone with borderline personality disorder, when under stress, may, not will, may see things that other people can't see, hear things that other people can't hear, or believe something that doesn't make sense in their culture. It's likely to have a paranoid flavor to it, and or they might dissociate. So what exactly would this look like? Let's look at what decades of research can tell us. One study has found that most people with BPD have at least one symptom of psychosis. Other studies conclude that between 20% and 50% of people with BPD experience auditory hallucinations, hearing voices. These generally happen only when the person is stressed, especially when they're experiencing anxiety about being rejected or abandoned, or they have been rejected or abandoned. And the voices are usually negative and critical. That's where we get the paranoid piece. The voices are out to get me. So, okay, how do we know that that's not a psychotic disorder? Maybe the person really does have schizophrenia, right? Well, if someone generally has friends and social connections, performs well at school or on the job, is well groomed and with good personal hygiene, and has organized thought processes, like can stick with a conversation through the beginning, the middle, and the end, but occasionally tells me that they're hearing a really critical negative voice, I'm going to think BPD, not a psychotic disorder. Those psychotic symptoms in BPD are generally transient, meaning they pass. They're stress-related, and they are overwhelmingly negative in tone. They don't have anything to do with hearing aliens through your fillings. Now, you may or may not know that we no longer rely on the DSM-5. Instead, we use the International Classification of Diseases, or ICD-10. That has a slightly different symptom set for borderline personality disorder, and it has a different name for it. Again, that's the topic for a different video. But it can be really difficult for doctors, especially if they don't have a lot of experience with borderline personality disorder, to diagnose BPD properly and not to confuse it with something else. A person can have more than one diagnosis alongside BPD. This is one complication. They might have depression. They might have anxiety, substance abuse, post-traumatic stress disorder, eating disorders. And as if that's not complicated enough, some of those diagnoses can have psychotic symptoms. Depression would be one example. Many people with borderline personality disorder experience dissociation, just as is referred to in that symptom, and that can be confused with psychosis, which makes diagnosis even more complicated. I mean, you say you weren't at coffee with me last week, but I was there. You were there. I have the photo on my phone. You must be delusional. Finally, people with BPD who have the symptom of unstable identity, they can look pretty disorganized or agitated, just like someone with schizophrenia. Someone with BPD who's experiencing interpersonal stress in the form of rejection can also look very disorganized, with poor hygiene, speech that goes off the rails often, perseveration, saying the same thing over and over and over, and they may not be able to stay focused on one topic. Now, I've said this many times before. The best treatment for borderline personality disorder is dialectical behavior therapy. The evidence says so. Mentalization therapy and ACT, acceptance and commitment therapy, are also promising, but DBT is the gold standard of treatment. When it comes to those transient psychotic symptoms, medications are add-ons at best. Any psychiatrist who's experienced in treating borderline personality disorder is going to be reluctant to address the symptoms with medication unless there's also psychotherapy in the picture. Not saying they won't do it, but they're going to be reluctant. I really hope that this has answered some questions about one of the most puzzling aspects of borderline personality disorder: transient, stress-related paranoid ideation. The bottom line is that what we most often see is that the person with BPD, when undergoing interpersonal stress, hears negative and critical voices, or even a single voice, and it passes. Thanks so much for watching.